Hello and welcome to South Asia Chart, brought to you by the Institute of South Asian Studies at the National University of Singapore. I'm your host, Dr. Chulani Attanayaka, a visiting research fellow at ISAS. And with me is Admiral Professor Jayanath Colombage. Today, we are going to discuss how Sri Lanka is responding to COVID-19. So, Professor Colombage, could you please share the on-ground situation with us? It was reported that Sri Lanka has a total of 210 confirmed cases as of today. How is the country tackling the pandemic?
Well, you are right. In Sri Lanka, as of today, we have 210 cases of COVID-19 and we have 7 deaths. And we have nearly 45 people who were cured and gone back to their home or back to the house quarantine. So the number 210 is not the real figure right now. It's much less than 210. I mean, in Sri Lanka, it was conducted like in 2 phases. Now, the first phase was when the epidemic started in the epicenter of Wuhan. The Sri Lankan students, there were like 34 Sri Lankan students in Wuhan, and we were very worried about the safety and security of them. And that phase, we did it very well. While we were doing it, the first case of coronavirus affected person, a Chinese national who were touring Sri Lanka, was detected, taken to hospital, cured, and sent back. And then there was a period about one month before we heard the next case or the next wave of epidemic coming to Sri Lanka. Now that came actually as imported case because the Chinese lady actually had not given it to anyone, very surprisingly. But then the imported cases started coming from Italy, South Korea, Dubai, and India. So right now we are going through that, and we are very fortunate. Although we have total 210 cases, the COVID curve, which is supposed to be in many parts of the world or in many countries, which had been an exponential curve, like the J, it's going flat a little and then all of a sudden it spike off. But it never happened in Sri Lanka. The moment we heard about this virus in Wuhan, our airport was ready. Our health mechanism was ready, and President had appointed an action committee. Right? These things paid off very well because we were prepared before it became a pandemic. I mean, it was an epidemic in China, but Sri Lanka was getting ready. We were getting ready not only with the testing at the airport, but also having test kits, testing agents, all the paraphernalia which is needed, and then identifying hospital, should there be a case, how to handle the patient.
So you mentioned about the quarantine system in Sri Lanka. We recently saw that the government has extended the quarantine period to 4 weeks from 2 weeks. What prompted this move, and how would this help containing the
right? You see, initially we went only for 14 days quarantine period. Now, I mean, these are figures, like we have by now quarantined about 3,500 personnel. So out of 3,500 personnel, only about 50 were contracted or identified as positive COVID-19. Now, out of these 3,500 people underwent quarantine, there were 2 cases after leaving the quarantine center. During the period of house self-quarantine, they were tested positive. So we were a little bit alarmed because then that means there is a possibility, although we keep a person in a quarantine center for 14 days, we realize that, if the person has contracted the virus towards the latter part of his stay, right? And then he goes to the society and, well, we request on self-quarantine, but, some people don't respect that. They start moving around. So we were very concerned about it. And that is why we decided, okay, this 14-day period may not be enough. And now we have to go for 21-day period. Now then there is another thing, because earlier, because you see Sri Lanka had never experienced a pandemic of this nature. We did not know, we evolved with the passage of time. Now initially we tested, which is called the PCR test, only people who are having symptoms of COVID-19, right? So that is what it was. If you are a symptomatic patient, we test them and then we say you are positive or negative. Now we have started testing even asymptomatic patients also, people who are not showing any signs. And also our target is whoever goes into a quarantine center, right, towards the 14th day, because we want to give them little time, like 10 to 14 days, we would carry out a PCR test. Now, if that PCR test is negative, right, then he or she may not have to wait till the 21st day period even. But that is a milestone, I mean, a yardstick we have kept as 21 days, but then we would be ensuring that each and every person would be tested for the COVID-19, and based on that we would decide whether we need to keep him or her for a longer period or not. So this 21-day period is an actually additional precaution which we have taken to ensure that this virus does not spread into the community.
It's very interesting to note that the government is very proactive in these measures, Professor. But yesterday it was reported that the schools and the universities will be reopened in mid-May. But in countries like Singapore, which had the situation under control, we saw a second wave. In this situation, is it a good idea for Sri Lanka to lift curfew and reopen for mass gathering?
Well, you see, I mean, every action the government has taken are based on expert, professional medical advice. I mean, the president is always listening to the medical opinion. Obviously, he is monitoring the world situation. He is getting the feedback from every corner, every strata of the society, every level in the military. But he listened to the professional advice given by the medical specialists, right? So the medical specialists feel, right, because the control, it's not like any other country. We are very fortunate, and one thing we have to remember, we are an island nation, right? So it can either come by air or by ocean, but ocean is very easy to control. Only very few people come and go. Most of them come and go. The ships come, they go. They don't even come inside, right? But air is the problem. So we believe that if we can be very strict, if we can quarantine every incoming passenger who is coming in the future, once our border is open, right, there we can control that. That is one thing. Now, because we have been doing it quite well, because our curve had never taken the upper part of the J, that is the exponential part, and because now we are detecting still nearly 2 months after the initial reporting in the second wave, not the first case, but second wave, we are doing very well, right? So therefore, we have a plan. The health authority said, okay, now we have to think of an exit strategy. We have to think of a lockout strategy. Now, the lockout strategy is critically important. As you said, the secondary wave, possibility of a secondary wave coming back, and the possibility of even the first wave still not detected and in the society. So that is why I said, now whoever in the quarantine center we will test, and whoever are the immediate contacts, the first, we call it the first ring, the second ring, and the third ring. The first ring is, you know, the person having immediate contact with maybe his family, maybe his best friend. But the second one is the ring that his family and the friends interacted with. And the third ring is the ring with his friends of the family and the friends interacted. And we have devised a very good system. Basically, it's human intelligence. It's not a high sophisticated technology oriented system. Yes, we do use technology, but this is basically the human intelligence, mainly coming from the army and the police. Now I think one of the successes, or one of the main reasons for our success, is contact tracing, contact mapping, and contact following up, right? That I don't think many countries have done it. Many people would have used technology. You are having a mobile phone, so you are traceable. But here it was not the case. It was a human intelligence. The individual goes and asks question, trace, and identify, and either they are isolated, self-quarantined, or they are taken to a quarantine center.
You mentioned about using human intelligence through the military forces. That brings me to my next question. So in Sri Lanka, we always see the military as the first respondent in any crisis. So why is that? And how equipped are they to handle a pandemic?
Well, you see, if there was no involvement from the military in Sri Lanka, I'm 100% positive this situation would have gone out of hand. The military, in fact, was not the first respondent in Sri Lanka. Initially, when the president created an action committee, when the virus was spreading in Wuhan, it has not transmitted to the rest of the world. When the virus was spreading in Wuhan, president set up an action committee. In that action committee, there was no military involvement in that, right? In that action committee was basically to prepare the emergency response preparedness, right? Only when we started getting the people into the country based on the advice of the health authorities, then president decided now it's a time to involve the military. Now military got involved and they did everything. You see, the military has the mobility and they have the logistic, they have the engineering, right? And they have very good command and control, right? Once an order is given, once an instruction is issued, it goes down the line and the feedback is obtained and you can ensure that things are happening.
Indeed, it is a time for collective coordinated effort, Professor. And it is a tough time, and we see Sri Lanka is doing well and doing its best under circumstances and challenges. On that note, thank you, Professor Colombage, for giving our listeners some important insights from on ground.
Thank you.
Dear listeners, we hope you have enjoyed this session. If you are interested to learn more about our analysis and our work, please visit our website isas.nus.edu.sg.